Hello and welcome to AI Explains Everything, the video series where we use artificial intelligence to explain complex concepts. Today, we'll be sparking a conversation about electroconvulsive therapy, ECT, commonly known as electroshock therapy. We'll delve into its definition, origin story, pros and cons, and the shocking controversies surrounding it. Believe us, it's not just a scene you witness in films. So, let's electrify our understanding of this stimulating topic, shall we? Electroconvulsive therapy, ECT, also known as electroshock therapy, is a medical treatment that involves passing electric currents through the brain to induce a controlled seizure. ECT has been used to treat a range of mental health conditions, including severe depression, bipolar disorder, and schizophrenia. Despite being a controversial treatment, ECT has been used for over 80 years and remains an effective treatment for some individuals. This video will explore the history of ECT, how the procedure is performed, its effectiveness, side effects, and controversies surrounding its use. History of ECT. The history of ECT dates back to the 1930s when two Italian psychiatrists, Ugo Cerletti and Lucio Boni, first used electricity to induce seizures in patients with schizophrenia. They were inspired by observations of people with epilepsy who had improved mental health symptoms following a seizure. The first ECT treatment was performed in Rome in 1938, where an electric current was passed through the temples of a patient, inducing a convulsion. The patient reported feeling better after the procedure, which led to the widespread use of ECT in Europe. ECT was introduced in the United States in the 1940s and quickly gained popularity as a treatment for mental health conditions. At the time, there were limited options for treating severe mental health conditions, and ECT was seen as a breakthrough treatment. In the 1950s and 1960s, ECT was widely used in mental health hospitals across the United States, with some estimates suggesting that up to 500,000 people received ECT during this time. How ECT is performed. ECT is typically performed in a hospital setting under general anesthesia and muscle relaxants to reduce the risk of injury during the procedure. Electrodes are placed on the scalp, and a small electric current is passed through the brain, inducing a seizure that typically lasts between 30 to 60 seconds. The number of ECT treatments required varies depending on the individual and the severity of their condition. Typically, a course of ECT involves 6 to 12 treatments, performed over a period of several weeks. Maintenance treatments may be recommended to prevent a relapse of symptoms. Effectiveness of ECT. ECT has been shown to be an effective treatment for some individuals with severe mental health conditions. The American Psychiatric Association and the National Institute for Health and Care Excellence, NICE, in the United Kingdom recommend ECT as a treatment option for severe depression, bipolar disorder, and some forms of schizophrenia. One study found that up to 80% of individuals with severe depression who did not respond to medication experienced a significant improvement in symptoms after receiving ECT. Another study found that ECT was more effective than medication for treating severe depression in older adults. ECT has also been shown to be effective for individuals with bipolar disorder who have not responded to medication. One study found that ECT was effective for up to 70% of individuals with bipolar disorder who did not respond to medication. Links in the description. In addition to its effectiveness for severe depression and bipolar disorder, ECT has also shown promising results for individuals with certain forms of schizophrenia. Studies have found that ECT can improve symptoms such as delusions, hallucinations, and disorganized thinking in individuals with schizophrenia who have not responded to medication. However, ECT is generally not recommended as a first-line treatment for schizophrenia and is typically reserved for individuals who have not responded to other treatments. While ECT has been shown to be effective for some individuals, the exact mechanism of action is not fully understood. It is believed that the electrical current applied to the brain during ECT may alter the function and communication of neurotransmitters, leading to a reduction in symptoms. ECT may also stimulate the production of neurotrophic factors, which can promote the growth and development of new brain cells. Despite its effectiveness, ECT is not without its limitations. While some individuals may experience significant improvement in symptoms, others may not respond to the treatment at all. Additionally, the benefits of ECT may be temporary, and individuals may require ongoing treatment to maintain symptom improvement. Furthermore, ECT may not be appropriate for all individuals, particularly those with certain medical conditions such as heart problems or a history of seizures. The risks of ECT, including potential memory loss and confusion, should also be carefully considered before undergoing the treatment. Overall, while ECT may not be a first-line treatment for all individuals with severe mental health conditions, it can be an effective option for those who have not responded to other treatments. As with any medical treatment, the risks and benefits should be carefully weighed, and the decision to undergo ECT should be made in consultation with a qualified healthcare provider. Side effects of ECT. Like any medical treatment, ECT carries the risk of side effects. The most common side effects of ECT include temporary memory loss and confusion. Some individuals may experience headaches, muscle aches, and nausea after the procedure. Memory loss is the most significant side effect of ECT, with some individuals reporting a loss of memories that occurred before the treatment. The severity of memory loss varies between individuals, with some individuals reporting only mild memory loss, while others may experience more significant memory loss that persists for several months. Controversies surrounding ECT. ECT remains a controversial treatment, with some individuals and organizations arguing that it is an inhumane and outdated treatment that should be banned. The primary concerns surrounding ECT include the potential for long-term memory loss, the lack of informed consent from patients, and the potential for abuse. Long-term memory loss. One of the most significant controversies surrounding ECT is the potential for long-term memory loss. While ECT is generally considered safe, some studies have suggested that it may cause memory impairment. Memory loss is the most common side effect of ECT, and it can persist for weeks or even months after the treatment has ended. The exact cause of this memory loss is not fully understood, but some theories suggest that the electrical impulses used during ECT may damage brain cells or disrupt communication between them. As a result, some patients may experience gaps in their memory or difficulty recalling past events. Lack of informed consent. Another controversial aspect of ECT is the lack of informed consent from patients. Some critics argue that patients are not adequately informed about the potential risks and side effects of ECT, and that they may be pressured into undergoing the treatment without fully understanding what it entails. Some patients may also lack the capacity to give informed consent, such as those with severe mental illness or cognitive impairment. In such cases, the decision to undergo ECT may be made by a guardian or family member, further complicating the issue of informed consent. Potential for abuse. Finally, some critics argue that ECT has the potential for abuse, particularly in situations where patients are forced to undergo the treatment against their will. While laws and regulations exist to protect patients from involuntary ECT, there have been instances where the procedure has been used as a form of punishment or control. Critics also point to the history of ECT, which has been marked by instances of unethical experimentation and misuse. For example, in the 1940s and 1950s, ECT was used to treat homosexuality, a practice that is now widely regarded as both unethical and ineffective. In conclusion, electroconvulsive therapy remains a controversial treatment that elicits strong opinions from both its supporters and detractors. While some argue that ECT is a safe and effective treatment for severe mental illness, others argue that it is an inhumane and outdated practice that should be banned. Concerns about long-term memory loss, lack of informed consent, and potential for abuse are among the primary criticisms of ECT. As with any medical treatment, it is essential for patients to be fully informed about the potential risks and benefits of ECT, and for healthcare professionals to exercise caution and ethical responsibility when considering the use of this treatment. As we wrap up this electrifying topic, let's hope we've sparked your interest in learning more about ECT. Remember, while it may shock some people to hear about the controversial history and potential side effects, it's important to keep an open mind and consider all the potential benefits as well. Whether you're a fan of this treatment or think it's a bit shocking, we hope you've enjoyed this electrifying discussion brought to you by AI Explains Everything. Stay tuned for our next electrifying topic. Please be sure to like and subscribe. Goodbye for now.